So Patric will be leading this session with Professor Gwantai, where we have various speakers joining us online and some physically. So over to you, Dr. Boruett. And thanks for the patience from the online team.
I believe this is Pat Parker. I think I'm supposed to be starting, but I'm not sure.
It's all right. I'll guide.
All right. Hi, Patric.
Good afternoon, everyone. Yeah, welcome to the afternoon session. This is a session that will focus on leadership in pharmacy. As you all know, as pharmacists, we play a crucial leadership role in the health system. So today we are privileged to have a team that is composed of our partners from Kansas, USA, through the Kansas Kenya2Kenya collaboration. So with us, we'll be joined by presenters who will be joining us online. We have quite a number of them. So for this session, we will start with introductions, welcome and introductions, which will be done by Pat Parker and Gwantai. Then thereafter, we'll have a session on organizing to execute versus organizing to learn. And that's a session that will be done by Pat Parker. Then thereafter, we will follow with a session on framing to learn. And this will be done by Ken Mishler. Then thereafter, we'll also have our own Dr. Nadia taking us through psychological safety. And then we'll have a session on learning from failures. So, you know, sometimes we fail and we pick our lessons from those failures. Then we'll also have another session by Peter Karimi, which will be about spanning occupations and cultures. Then I'll end by having a session on leading yourself. So I'm Dr. Patric Boruett. I'm a pharmacist. I graduated from the University of Nairobi in 1997. And I've worked in hospital, in the NGO with Management Sciences for Health. And I currently work in the county of Baringo as Director, Preventive and Promotive Health. So I'll now move to the first session where I'll invite Professor Gwantai to just make some introductory remarks. And then we'll invite Pat Parker to continue with the session. Welcome, Professor Gwantai.
Thank you, Patric Boruett, for facilitating this session. My name is Professor Anastasia Gwantai. I think we have interacted for the last 2-3 days with all of you. But let me just say that I'm a professor of pharmacology and therapeutics in the University of Nairobi, currently retired, but appointed as emeritus professor of the University of Nairobi after recognizing the contributions that I've made in the University of Nairobi, because I've worked in the University of Nairobi since 1980. Okay, so about 40 years or 40-something years. And I have been a chairman, I've been a dean, I've been all sorts of things in pharmacy administration. I think in summary, I have served for 15 years as a dean, acting dean, substantive dean, coming in and out, being reappointed by the vice chancellor, and so on and so forth. So a whole total of 15 years as a dean. And I think almost all the major milestones that have been achieved in the School of Pharmacy, you can count my name there. And I thank God for that. Now for this session, I think what is important is for me to mention something about a partnership that we have with University of Kansas, US. We have been in partnership with the University of Kansas 2014, or I think 2012, okay? Pat, you can correct my dates if I'm wrong. And through this partnership, we have done quite a lot. We have had leadership training programs that we have had a series of them for a number of years. And much more importantly, we started running the vaccinology training with the US partners, a program that has seen training of over 300 pharmacists in vaccinology. Some of them have started their private practice focusing on delivery of vaccines, particularly in the adult population, because you know that in the pediatric population, they are already taken care of, by the government. So we pick from there and we make sure that the population is given access to vaccines. And I pay tributes to Professor Patric from Kansas University for leading this team. He always has a program that runs in June where he comes over not only to run the vaccinology program in partnership with us, but also hold some medical camps through a partnership with some mission hospitals in Nakuru, and I think occasionally in Naivasha. Pat, you can correct me. And in our contribution even to that medical camp, we always appoint some 5, 6, sometimes 7 students to support Patric Parker in running that program. Occasionally, when we have members of staff that are available, we also join him in delivering that medical camp. We already have a vaccinology training program. We have very nicely done booklets that we use. And the country is actually picking up from us because I know even the PSK now is trying to introduce some training in vaccinology. We have trained persons from other universities, including USIU, and I think they are also starting a vaccinology program after learning from us. So we are trailblazers, and I really appreciate the effort and the contribution from faculty within the School of Pharmacy at University of Nairobi and our partners in the US. When Patric comes over to Kenya, he doesn't just come with the senior staff. He also comes with a team of students from his school. And they are always given the opportunity also to act as trainers and facilitators during the training program. And through that, our students also get a lot of mentorship and interaction with our US counterparts. Not only that, the program has also supported our students, particularly during their 4th term rotation. You remember those that are going through the faculty of pharmacy or School of Pharmacy, they always have a 4th term, after 4th year. They have a 4th term before they transition to 5th year, which is, I think, now it should be around 12 weeks, of 4th term that is split between going through 4 weeks in community pharmacy, 4 weeks in retail pharmacy, community or retail pharmacy, 4 weeks in hospital, and 4 weeks in industry. Now, for the clinical rotation, that is hospital and community pharmacy, University of Kansas decided to partner with us, of course, upon our request, that we can identify 1 to 2 students that we can send over to US for mentorship and training through there, okay? So that has been happening for a number of years now. So every year we have an opportunity to send 2 of our students to spend at least 12 weeks in the University of Kansas, okay? To learn some very essential skills, including cardiopulmonary resuscitation, which we don't offer here, but those students that have benefited from this partnership, they come back telling us it is awesome, and many more students are requesting for that opportunity. It's only that, again, the slots are rather limited, because when I put a request to the students to volunteer to go for this program, I normally get a list of not less than 10, and from that 10, you are supposed to select only too, it has been a difficult task for me because those that are not selected, they always want to come back and ask, why was I left behind? And I find it very difficult to explain. So Patrick, if you can be able to open more opportunities for our students, we have many, many more than we have been able to support in the past. So there's a lot that we can say about our partnership with University of Kansas. It is growing stronger and stronger by the day. Okay, thanks to the dedication of Patrick Parker and colleagues. So I think because we are running short of time, let me stop there, Patrick, and let me invite you to say one or two things about our partnership, and thereafter you deliver your presentation on leadership. Thank you very much.
Prof, thank you so much for the introduction. The partnership, first let me say congratulations to the University of Nairobi School of Pharmacy for their 50 years of providing education for pharmacists in Kenya. Our working relationship has been excellent. We've been doing this for roughly 15 years. And so as a representative now of the University of Kansas, K2Kenya Medical Missions, and previously Lawrence Memorial Hospital, we really appreciate the opportunity to be invited to this program. And we relish the chance to work with the folks in Kenya. We learned so much. And I see some people that we've worked with in the audience that, Nadia is there with a big smile on her face, and Patric Boruett we've worked with, and certainly Peter and others. And it's been a great partnership, and we appreciate that opportunity. And we know that, while things are a little difficult right now, that they'll settle back out and our working relationship will continue to grow. So for the last roughly 15 years, our program has been engaged in this work. And a little over 10 years ago, we met with the University of Nairobi and talked about programs that we could do that perhaps would have an influence that would be positive for both programs. The intent was very simple. We wanted to provide opportunity for students and learners in the US to find out more about the world of pharmacy. And this has been a great opportunity for us to do that. We learned so much by coming to Kenya, and we really appreciate that. One of the things that we have done or tried to do each year is provide an academic program. And so we're going to do a very abbreviated program this year that hopefully you'll find interesting and useful. Let me go ahead and start with some slides. If I can get the slide share piece of this, I'll put the slides up and see if that works. So we've seen the introductions earlier, so I'll move through that. I work with the Pharmacy Leadership Academy of the American Society of Health Systems Pharmacists, and I've been an educator in that program and one of the professors in that program for a number of years, almost since its inception. And that group looks at leadership a kind of around 6 primary competencies, starting with communication and relationships, the discussions of safety and patient-centric activities, enterprise alignment, which talks about assuring that everyone is working toward the same set of goals, an executive presence and professionalism, talent and knowledge management, and business skills and acumen. All of those things are components of leadership competency. The executive presence in and of itself has some collaboration competencies. The first being ethics and values. If you're going to work within an organization, it's important that you share the ethics and the values of that organization. And if you don't, you really don't belong in that organization. And if they are not ethical and they do not share good values, you shouldn't be working with them anyway. There are competency relationships from communication relationships. There's roles and responsibilities within the framework of your work. And then there are team building skills. And that's actually what we're going to be talking about today. We're going to be spending our time in that component because team building is an important component of being a competent leader. You heard earlier the program pieces that we talked about. My job in this is really fairly simple. It's to introduce the people that are going to be talking about the components of team building. And we're using as our model the work from Dr. Amy Edmondson, who's a very well-known author and researcher on teamsmanship. She's written several books, one of which is called Teams, which she updated just a couple of years ago. But it's an excellent bit of work. And she basically has said that there are 4 components that are necessary to build a high-performing team in a particular model that we're going to be talking about. And that is that you have to frame that work so that you are framing it to learn rather than to execute. And we'll talk more about that. That you have to create an environment that is psychologically safe, that is where people feel like they are heard and they're safe to work in the environment and are not bullied. They want to look at a program as well that learns from its failures. Most programs do not honor failure. In fact, they think of that as failure as true failure. But in a learning environment, failures are looked at differently. So we'll have an interesting discussion about that. And then one of the things that's really important is that you want to span the cultures and occupations that interact with the team. And for pharmacy, that really is a surprising number of people. It's people, it's physicians, it's nurses, it's patient groups. It's, as you all have very well discovered, it's also the legal groups that you work with, the societies that you work with. Oftentimes it's labs. It could be a number of people. So, those occupations, to be effective in the workplace, you need to be able to span those occupations and cultures. And interestingly enough, I think for us, coming to Kenya helps us understand from the pharmacy standpoint, the difference in cultural relationships. And so the importance of that is not small. And then lastly, Patric Boruett will be talking about an important component of this, which is leading yourself into these components so that you can be effective as a leader. So that's what we're going to be looking at. There are 2 overall approaches to management, very high level. The first is you can organize to execute. And in organization to execute, basically, the organization itself is thought of as a mechanical system. It places a high value on control. It focuses on metrics and the bottom line. And it rewards an individual for their personal performance. It looks at the organization as kind of like the traditional workflow of how you build a car. And that mechanism is, you start with a product, and at the end you're finished. You put a bunch of things together, and at the end, you have a mechanical system that works well or doesn't work well. And people are rewarded on their personal contribution to that. There are situations where organizing to learn, though, is a completely different model. Again, organizing to execute seems like a good model in most situations, and it sounds like pharmacy might fit there very well. But there's another way to go about organizing. If the organization is a complex adaptive system, that meaning that there is constant change associated with it, then you're actually better off when you're creating your teamwork, you're better off organizing to learn. In this situation, the value is placed on learning, for the team to learn, not for the individual to learn. Because if you think about it, if you're organized to execute, how do you move up in the system? Well, you move up in the system by being better than somebody else. But in a program that's organized to learn, the system, the value here is how well is the system working? What is the overall capability? So you as a person, as a leader within the system, want to make sure that everyone is contributing well. You know, if I'm in an organizing to execute program, what value does it bring to me if somebody else is doing a really good job based on things that I've taught them? You know, because now they're a competitor. But in organizing to learn, if I can teach someone how to do something better, or if we can come up with a better way as a team to do something, then that makes the team better, and that makes the team more valuable. It brings value to the team, and the reward then comes to the team rather than to the individual. The real question is, which of these is pharmacy? What are your thoughts? Think about this for a second. So I think it's an important consideration because, you know, a lot of people will say, well, I'm in a small program and I just need to get prescriptions out the door fast and get them out accurately. That may be a big piece of what you do, but it probably isn't all of what you do. I'm going to suggest to you that pharmacy is not a mechanical system by and large. It's a complex adaptive system. Why do I think that? Pharmacy has to assimilate new drugs and new technologies very quickly. And they are, as you picked up, you know, in some of yesterday's presentations. I love Dr. Aluka's and Dr. King's presentation yesterday on pharmacogenomics. You know, that's a complex set of processes, and it's changing all the time, and new information is coming out. Dr. King noted that, you know, just a few years ago, there were in the primary reference, one of the primary references that she was using, there were 35 drugs listed. Now there's something like 150 or 160. That's change. And to assimilate that new technology and those drugs quickly, that is in fact a complex adaptive system. You want to identify evidence-based standards. And very much like we saw yesterday, how will you apply this new information on pharmacogenomics as an example to make to make use of this new knowledge and keep your patients safer and make sure that they get the very best drugs that will in fact help them? So in this situation now, you can decrease avoidable variation and reduce costly errors by the application of that high-level technology. And you have to be able to work across boundaries. Think about that, because that's a really important consideration. Those boundaries include, you know, what's your relationship with nursing? What's your relationship with physicians? I'm going to suggest to you that your relationship with physicians is changing. I have seen that change over the last several years. We saw it particularly as we advanced the vaccinology program. You know, we were told, well, pharmacists don't vaccinate in Kenya. They do now. All over Kenya. There are 300 pharmacists that are now certified by the University of Nairobi to vaccinate. That's a change. That's a change. Is there a benefit to the patient population in Kenya? And the answer to that is blatantly obvious to everyone that's taken the program, and I'm quite sure everyone in this room, they know. They know. So to work across boundaries means that you have to be able to talk to the physicians and nurses and the health systems and health professionals that have regulatory authority to be able to move those kinds of programs in place for the benefit of your patients. That's working across boundaries. How is this different? You're going to see this again, and I'm just going to go through this very quickly. But how is it different? How do you manage in an organized to execute versus an organized to learn environment? your management approach to hiring, if you're organizing to execute, you want to hire people that are conforming to the rules that you have set. When you organize to learn, you want to hire people that are problem solvers, that are experimenters, people that will play with stuff. You want the kid that when he or she was a child, broke every toy they had and tried to put it back together. Make sense? For training, usually when you're training in an organized to execute, you're doing all of the learning, all of the education, and then you do stuff. But learn by doing in an organization to learn. It's get in, get your hands dirty, figure it out. And by the way, if you see something interesting along the way that could be done better, tell us about that. In an organizing to execute environment, a lot of times people will come to you and say, well, yeah, I've known for years that, we were doing that wrong, but no one ever asked me. Or there was a better way to do this. In organizing to learn, that's a complete anathema. People would look at organizing to learn and say, no, we need to know that yesterday. We need to know that at the minute you see it. Measuring performance. Again, what did the individual do? How many widgets did you produce today? But in organizing to learn, it's how many widgets did the overall program produce today? And by the way, should we be making something other than widgets? Is there something else we can add to the things that we do? Structure of work, separate expertise, integrated versus integrated expertise, that's obvious. Employee discretion is you get to choose from the options that we set. In organizing to learn, people will come up with, hey, I want to try something. And usually people will say, well, let's talk about that and figure out how they could try it. And as you are very well aware, when you try stuff, it's going to fail. That's an interesting problem, isn't it? Because if things fail, that's bad. If things fail, you want to fire people for that, right? But not in an organizing to learn environment. Empowerment means if you deviate from the script, only when special needs arise. But in organizing to learn, there is no script. You're supposed to improvise. You're supposed to make things, improve. If process goals drive out variance, you want to use variance analysis, pardon me, to improve your work. So you look at variance and you look at variance publicly. If you're in an organizing to execute environment, I've got great stories about this when we build this program out in a larger scale. I've got several stories about this from my own experience, but people will hide the errors that they make or the variance in their programs. We saw this in Unidos Cartfield. People didn't want to share the errors that they made. But in an organizing to learn environment, those errors got shared. And when that happened, people started looking, well, why are we having this kind of error? Maybe there's a better way to do this. The water cooler talk, what happens when people are just getting together on a break? Well, they talk about the weather. But in organizing to learn, people are talking about, hey, did you see what Ken did? That Ken Mishler, he's a smart guy. Did you see what he did in his program? Maybe we should try that. Did you talk to Nadia? I talked to Nadia the other day. Holy cow. Nadia and Peter Karimi are working on projects in Kenya. That stuff, some of the stuff they're doing, we could do. We've just never tried it here. It would work. Let's try it. The business goal in organizing to execute is, let's decide how much we're going to make and figure out how we're going to make it now. Organizing to learn takes a larger scale. It's like, how are we going to be successful over the long term and not be a little successful, but just be powerfully successful. It is important to recognize that there are times when organizing to execute works really well. When the path forward is clear, you follow the path. But in organizing to learn, if the path forward is not that clear, then it's time to put together organizing to learn in your workplace. And I'm going to suggest to you right now, think about this. Is the path forward clear? I'm going to suggest to you that perhaps it's not entirely clear, and that perhaps you could have an influence on that path by the contributions that you could make. So we're going to be talking today about framing for learning, making it psychologically safe to learn. In other words, how do you learn from failures? And spanning occupational and cultural boundaries. And then we'll summarize all of this with a discussion about leading yourself. That's what we're going to be talking about today. So I would like to now turn this over to Ken Mishler, where having Ken talk about framing for learning. And I'll turn over the slide deck to Ken.
Well, good morning. My preference would have been to be there with you, and we'd all be sharing these things in person. But given our limitations today, we'll be trying to share this in a virtual sense. So my goal here today, and we're getting started right on time, so my job is to keep us on time. Pat, do you need to?
I think I need to get out of the share piece of this, but I'm not entirely sure how to do that.
Yeah, I can't pull mine up. It says my slide deck up.
Maybe our, hold on just one second.
I'm looking at my desktop. I've got this document on my desktop.
We can we go to Nadia's presentation, then we come back to you once you've shared? Would that be okay?
Yeah, sure. I don't want to waste any more time here.
So do this.
Good morning to the Kansas team. Good morning to the Kenyan team here.
Good morning.
Oh, sorry. I'm still in morning. Good afternoon to the Kenyan team. Today, I'll take a 10-minute presentation so that we can save on time as soon as I can see the screen. Thank you to Pat for his kind words, always encouraging us here. It's an honor to be in front of colleagues and mentors. To be on the same platform as you is encouraging other people also. I'm class of 2007, just so you know where the white hair is coming from. Okay, so we're going to be talking about the psychological safety aspect in leadership. There we go. Okay. There's a lady, her name is Amy Edmondson. She's from the Harvard Business School. She's a professor there, and she does a lot of these talks on psychological safety. So we're going to take from her and we're going to discuss. So she says a belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. So I'd like to take a vote in the room. At any point in your career, did you feel like if you speak up, it will not be heard? Or you're embarrassed to speak up because someone might think it's not a correct answer? Just a vote, hands up. Have you ever felt that in your workplace from the beginning of your career to the end? Yeah. So I think 95% of the people here can say there's a point in time. Of course, usually that point comes early on in your career rather than later on, because the people in this room, although they were very kind and put up their hands, I'm sure they're in the senior positions and don't need to worry about that anymore. But it is true. Sometimes you feel you're in an atmosphere where you feel if I say something, it will not be acknowledged. So it's really important to have that safety net. So the components that foster that are behaviors of our leaders. How does the person in charge deal with his staff? And the behavior amongst peers. How do we behave amongst ourselves? Are we talking about how bad the question was that the other person just asked, or we're laughing about it behind someone's back? But really, you find that in any organization, the statement that that person made that one person will laugh at, maybe two, is the same thing someone else was thinking, but they didn't have the courage to say it. So we need to create that safety net. So please advance the slide for me. Okay. So the role of leadership. Leaders set the tone for psychological safety. And we need empathetic leaders, the ones who are there to teach, to build trust, and that's how you proceed as a team. So there's 1 second. We'll move to the next slide. If you look, there's a nice diagram here about psychological safety and accountability, how that whole system works out. If you look at the top left, I'm making sure I'm talking in the right direction. So the top left corner, so that would be the comfort zone where people feel safe to express themselves. And there's little pressure to have high standards. Then comes and that's a positive atmosphere actually. But the problem is sometimes we get into the comfort zone. When you're in the comfort zone, you're not willing to push as hard. So do we really want to be there? Maybe, maybe not. Then you go to the learning zone, which is the top right-hand corner, where you find that it's an ideal environment to learn, where someone is safe to say their opinion, to take risks and share ideas. But at the same time, we're holding them to high standards. So we want them to perform. So that's an ideal situation, right? And then we've got the apathy zone. You can just tell by the name that doesn't sound very good. That's the worst case scenario that you're dealing with there. That's the left bottom corner. So it's where employees feel that they're not respected, they're not valued, and they disengage. They kind of move back and say, okay, why am I working so hard if no one is going to help me through this? So people hesitate to speak up and work. Then we have the anxious zone. I heard in another presentation, we should never say the word anxiety, but it exists. It exists a lot. And there's pressure for the employees to perform and the fear of failure. So both are not good, really. So we don't want to be in that zone either. So the key takeaway for this, let me see the slide. Okay. Yes. So the key takeaways are that psychological safety without accountability results in comfort. So it doesn't necessarily provide growth. Accountability, on the other hand, without psychological safety creates an anxious environment. And that's not good either. So the best balance is that found in the learning zone, where teams feel supported and challenged at the same time. So we want our staff to be in the top right-hand corner, where they're always willing to perform and they're fearless. They're willing to move ahead and take those risks. So the leader's toolkit, as you can see, I'm trying to follow on both sides, but you want to normalize vulnerability. So the person in charge, your lead, should say, I made a mistake too, or that idea didn't really pan out. It didn't work for us. So they should be able to acknowledge their own mistakes and uncertainties. And that encourages others. And then there's encouraging open dialogue. Are we listening to our team? Are we taking the opportunity to get feedback from our teams, or are we just letting it be? There's those people who like to just lead the team and everybody follow without opinion. And that never works out well. Then establishing clear expectations. It's always good to know where you want to end up, but also the road is not always clear. So you want to have respectful communication to pan out your route ahead. You want to promote inclusive decision making, so you want to involve everyone in the team to make a decision. You can find so many greater ideas if you just allow someone to speak. So the next one would be train leaders in empathy. When someone comes in overwhelmed, you see someone coming in tears. How do you deal with that situation? Do you say, okay, we have a 10 o'clock deadline, let's do this? We can't be doing that. We need to be empathetic. So, and also the staff or the student needs to be able to go to their mentees and feel like they're safe to tell them, well, I had a really bad night and this is what happened. It's okay if we take those 5 minutes to counsel someone. It may make their day. I've had a person who came to me and told me I was about to commit suicide over the weekend. Now, how do you digest that? Do you just blow it over? What do you do? So you need to take that time to be empathetic and be honest, and also have those conversations with their work. If they're not performing, no problem. One, it might not be for them. Two, maybe they need a little bit of empathy and guidance. So sit down and talk about it. Next thing would be recognize and reward psychological safety. If someone does something and they failed, but they learned. I heard this in the dining hall just right now. Someone said, you either succeed or you learn. There's no failure. And I love that. I think it was Dr. Mika who said that to me outside in the dining hall. And I think it's so important that we realize that not every failure is a failure, especially if you learn. If you didn't learn anything from it, well, then you're a failure to begin with. Yeah, so addressing the power dynamics. We need to reduce the hierarchical challenges or barriers that exist within institutions. And then we need to have that mentorship support center. So maybe every organization has 2 or 3 mentors to take on the mentees and work as a team to help them through it. And then implementing psychological safety metrics, use surveys, assessments. How do we assess where things are going? These are the 4 levels of psychological safety. I wanted to show you some questionnaire, but I'll show you that afterwards. So you can see there's challenging, contributing, learning, and included. You can see where every one of us at one time belonged, and now maybe where you belong. So now, to assess how this psychological safety is working in your organization, how will we know? We say we're making people feel comfortable. Are we? Are they safe? So there needs to be a system of assessing this situation. And it would be, obviously, we say anonymous, and it should be anonymous. And you'll see how that works. So if you look through here, there's some general workplace environment questions. I feel comfortable speaking up. So someone would tick mark, strongly disagree, neutral, etc. My manager encourages me for open and honest communication. So in each category, we have a few questions that we could use. Team dynamics, team members respect and value each other's contributions. You'll be surprised how you'll get some negative comments in here, and you realize that, in fact, definitely there are some setbacks, and it's a person that's a part of the team. Then section 3 would be on leadership and support. What support are you providing your staff? Are they secure enough to come to you and tell you those the downfalls or their failures and how we can move forward? And then open-ended questions. What aspects of psychological safety do you think need improvement? Ask the team, what do you want us to ask you? So they already have the answer, but they can tell you what the question is supposed to be. You share an example of when you felt psychologically safe or unsafe at work. There are questions that we fail to ask. And I don't know about anybody's organization here. I would love a hand up. If you can tell me if you use this type of psychological safety aspect at work. Okay, we're really not doing well, are we? I have no hands up. I can't see the people online, so I'm taking this as a reflection, as a true reflection of the way it is out there. It seems it's not employed in Kenya. So it's okay. We're learning. We'll get there. So this is just a brief questionnaire, and then you refine it in strategies. You can base off of these answers, you can base a strategy of how to help your staff. So indicators. If we're looking at indicators of psychologically safe work environments, open and honest communication is kind of a repeat of what we were just discussing, but employees feel comfortable sharing ideas. They encourage constructive dialogue and active listening. Then we have supportive leadership. I think we have more leaders in this room than we have mentees. I'll consider myself one of the mentees right now. So we have a lot of mentors in the room. How supportive are you with your teams? Luckily, the ones that I've belonged to, they're sitting in this room right now. They have been absolute wonderful leaders. They listen more than they speak, and that's a trait I have to learn from them, which is listen before you speak. And it's really, really, it makes a difference on how you work. Encouragement of innovation and risk-taking. Employees are they're empowered to take risks. So we allow them to make a decision and follow through with it, even if maybe you know in the back of your mind, okay, this one is not going to work out. I'm pretty sure. But you let them do it because you know, okay, fine, we'll be behind a couple hours, but he's going to learn by failing or she's going to learn by failing. And it's okay because it's not failing, it's learning. So as long as you can, the benefit of that experiment outweighs the risk, then you can do it. And then respect for diverse perspectives. Realize that everybody comes from different backgrounds. And in different backgrounds, people have different thoughts. And it's okay. So we just need to respect that. Psychological safety and feedback and accountability, same thing. Feedback, feedback, feedback. Let's have people doing these questionnaires. Let's talk about what they've learned, what they would like to learn maybe, and what's hindering them from it. And then inclusive decision making. That concept of maybe quorum and 50+1 votes, it's a good idea. Like when we do it in teams or boards, we do it to make decisions. But even when you're doing it in decision making on a smaller scale, it's still better to have the impact of the team rather than one. And a team is always dependent on every member of its team. And then the low fear of retaliation. Do you think if you're going to make a certain decision, who's coming after you? Who's got your job next? It can't be the case. So we need to change how we work in our organizations. High employee engagement and well-being. Show and celebrate people's wins. Celebrate the win. Every day you go into work, celebrate that win. Oh, I finished that paper today. That's a win. One less thing on your schedule today. Celebrate your wins every day. And even if you're in uni right now, you finished your paper, celebrate that win. You made it through that day. And I know how hard it is to make it through that day. So it's okay. So from this, we take actionable steps and we improve. So it's really important that we take in leadership a little bit differently and we look at the team, because without a team, you don't have any leader anyways. I think that's, see, I was quick. So that thanks was for being quick. It wasn't even for a good presentation. I think, Ken, we're back to you. Pat will take over. Patric, there you go.
I think that was exactly perfect. I really enjoyed that. Thank you. Patrick, you want to introduce Ken and get him started?
Yes, I think we've received the presentation, so we should be able to load the presentation.
Okay.
So you can.
And we're doing the framing. I have two, so I'll do mine back to back. And while you pull this up, pull up my presentation for framing. It would appear that we're out of order in our presentation, but actually, I think starting out with psychological safety, even before we start framing the work that is to be accomplished, incorporating psychological safety is something that really should come first. So the fact that we're a little bit out of order here, I don't think really detracts from our overall attempt and our message that we're giving today. So if you could pull up the slides for framing, we'll start that. While they're pulling that up, I'm going to make a couple of just make a statement here. So I'm a pharmacist. I've been a pharmacist since 1982. It's the only thing I think I've ever really wanted to be, and I have a varied background. But for one of the probably most pertinent to this presentation today, for 10 years of my career, I worked for an organization that did healthcare quality improvement. And healthcare quality improvement, and we worked under contract with the government. And our work was going out to mostly small hospitals in Kansas, where I live. And we worked with those teams we worked with those hospitals on specific projects that helped hospitals improve the care that they delivered to their patients. And I'll give a couple of examples here while we're waiting for the slides. Some of the scopes of work that we did was helped hospitals reduce the number of postoperative surgical infections. And there are obviously, again, this is back in the 90s, and there were very good evidence-based procedures on what are the best things to do to help patients to be implemented by the hospital to make sure that their likelihood of having a postoperative infection was reduced. And so things like giving a dose of antibiotic at the appropriate time before surgery and clipping hair rather than using razors. There were a number of things. But so each hospital had a team that worked together in these hospitals, doctors, nurses, pharmacists. And so what they would do, that was important. We worked with those hospitals individually. But probably one of the most things that was, as we think about organizing to learn, is we brought hospitals together that were similar in size, and these hospitals shared things that worked for them, things that didn't work for them. So not only were we working with hospitals individually, but we also worked with small groups of hospitals as cohorts. And so they would then share their ideas. And so many of the things that I read in this book and that we prepared today were things that I wish I'd have learned back then when we were working with hospitals, but many of them really played into things like psychological safety. Did nurses feel safe working with surgeons in a team to try to reduce postoperative surgical infections? And so I see the slides now. If you'd put them in presentation mode, we can get started here. So one of the first steps that we have to do, either before or after we think about the psychological safety, is we have to begin to frame what it is that we are going to do. Well, we can just we can work with it on this. I think if everybody can see it, you're going to see my notes here underneath, but we'll just go ahead.
So, can you advance that slide, or can you?
Oh, I don't know. Maybe I can. No, I am not able to advance it.
Okay, so
wait a minute.
We have.
Patric, just let us know when we need to advance to the next slide.
Okay. So at any time you get a group of people together to accomplish a task, they're going to come in with their own set of biases and their own set of assumptions, because they work with a group of fellow nurses, they work with a group of fellow doctors, and in our case, they're coming in with looking at it through the prism of being a pharmacist, working with pharmacists every day. And so one of the important things, they're going to be thinking about this based upon what is it we're going to change that will meet my needs. Me as a pharmacist, we want to improve this. Me as a pharmacist, I want to change that. Okay? So what it is, one of the very important things that leadership has to do as we begin to frame for learning is we're not wanting to just build more widgets or improve the number of medications that we roll out of the door, but we want to improve this on behalf of our patients. And so many times people will come in and they will putting these preconceived notions. Oh, perfect. So if we back up a slide, we'll be right where I need to be. So I need to go back one slide. Okay, very good. Now we're on roll. So framing the work that needs to be done. is very important for leadership, because people are going to want to, not only are they going to want to be self-serving, and the need for this team to set aside their own preconceived notions, but to begin to think about things in terms of, I am dependent, we are dependent upon you, and you are dependent upon us. So framing the work that needs to be done is really a critical leadership action that we need to do, to say, pharmacy, you're a member of this team, and you need to set aside those things that you feel like need to be done, and think about this in terms of us. And so it really, in framing this, and leadership's framing this, this is what we want to accomplish. And to be very clear about what helps people to understand what may be kind of an ambiguous set of information. Obviously, leadership's going to know, hopefully know the full picture and the full scope. That's how they bring people together, that says, well, we're going to need doctors, we're going to need nurses, we're going to need perhaps maybe physical therapists, whatever it is, we're bringing this group together. But each of them are going to be looking at it through the microscope of what it is that they want. And by framing what we are going to do, and maybe what we're not going to do, we used to talk about this in terms of what is in scope for this project and what is out of scope. We're not going to talk about these things. We are going to focus on this. And that really helps the participant begin to understand what performance expectations are there going to be. And the first, is to begin to build this environment for teams, members to begin to work together. How do they learn from each other? How do they collaborate? I need to look at this as a pharmacist from the perspective of a nurse. I may need to look at this from the perspective of an administrator. And so we oftentimes need administration. And this is the most critical step to creating an environment that is conducive to learning and collaboration. And also it actually, by framing this, actually motivates the participants to see, what is the end goal here? How do we begin to all collectively bring this organization to where we all see things, not seeing the big picture, but also seeing that this goes beyond my own personal or professional perspective. Next slide, please. I couldn't help but think about this in terms of, when we talk about framing what's inside and what's outside. I looked at this from the standpoint of, how do we look at this as art? And I chose kind of an impressionistic painting, because oftentimes in impressionistic paintings, things are not really very clear. And oftentimes when we talk about art, the frame oftentimes is just as important to lending what is the perspective of not only the artist, but what is the perspective of the viewer. And we could look at this and say, well, depending on how we look at this, this could be maybe a cat setting, or a chicken, or some kind of a bird. It's not really very clear where we're going. But obviously, when we look at the same painting with something that really doesn't fit with it, as it is on the left, versus what is that frame actually bringing to this patient, or bringing to this painting. And so I think what's important is, not everybody's going to look at this piece of art the same way, but there are clearly boundaries. And those boundaries actually add to, or the frame can actually add to, or it can actually take away from that painting. And so the leaders can facilitate teaming and accelerate learning by explicitly promoting what each team member is bringing to this work, so that nurses can understand what pharmacy thinks is important. and pharmacy can begin to understand what doctors are feeling about where it is that we're taking. And so, as well as the struggles for a larger purpose, having the frame and the beginnings of what is constituting what's inside the frame actually it is what begins to inspire us, inspire the team, and it begins to start to bring them together within the framework of what this project is bringing. Next slide, please. So framing is really just a set of assumptions and beliefs about the situation. But not only is there the frame within what leadership is bringing to this, and to beginning to say what it is that we're trying to do. We're trying to improve some quality of care. We're trying to create a new business around a specific need that we have. But then as this moves on, every participant is going to begin to develop their own frame. So if you will, a frame inside of a frame, because then I begin to change the way I'm looking at it, but yet my perspectives are still there, but I'm now beginning to incorporate what other participants are interpreting as what's going on around them. So as they begin to share and begin to learn from each other, it will begin to represent our reality, not just my reality, not just the way I look at it, but the way my reality is beginning to change based upon other participants. And without the psychological safety and some of the learning from failures that we have, it's going to be very difficult. It's going to be important that we all realize that everybody has their own frame, and that frame over time will begin to represent our new realities. Some of the other things that comes in with these cognitive frames, what am I thinking about this, is that conflict is often viewed as competition. And I think Pat mentioned about this. Is this going to be a contest between what am I going to get, what is nursing asking for, and what are they going to get? But it is really, as we go over time and we create those areas of safety, that psychological safety, that we can truly begin to work together. Next slide, please. So framing is learning. Pat set this up very well in talking about performance versus learning. I'm not going to get over, but if we think about things in terms of performance, the number of widgets that we create, if we're in a manufacturing situation, or how quickly do we get medications out to our customers, or how quickly do we get them to the care unit floor? Yes, that's important. But as we think about this in terms of looking at the task as what do we take out that's either redundant, and do we streamline the system, that's very important. I think there's a couple of things that came to mind when I was putting together this framing as learning, is some, the philosopher Epictetus from Rome in the ancient age said something that I think fits very well here. It is impossible to learn that which you think you already know. And so I think this plays out into how these frames begin to get built, and that everybody begins to kind of create their own perceptions as they begin to learn from each other. And so as we begin to pull these people together, that in a performance situation, it's really a process-based improvement. Okay, there is an end goal. We want to improve by 30%. So everything that we're doing is driving towards this goal of really a performance-based situation. And when we get to that, we take this out, we put this in, we move these things around. But think about this in terms of a learning situation. And this learning situation really never ends. Is that we're all learning from each other. We learn from our failures. We learn from our successes. And so a learning situation is that, well, we've accomplished our goal, that's it, we're done. That's in a performance-based. But in a learning-based situation, there's those opportunities to learn in a continuous sense. And that once we begin to learn this, we will begin to perceive things that maybe nobody really understood. And that it's not just about taking the current work and reworking that work. It is learning from the work that we've already done, and that each participant begins to learn from the collective team or the collective teaming. This really does encourage experimentation and innovation, because now, me as a pharmacist, I'm looking at this from the perspective and what I've learned from the physicians in the group. I really do. I think another good kind of analogy to this is, it's like asking, when we're talking to patients, asking them closed questions. In other words, do you smoke? Yes, no. Do you drink alcohol? Yes, no. And changing that to say, as we think about communications with our patients, is asking open-ended questions like, tell me about your alcohol consumption. Oftentimes we know this patient already drinks alcohol, but tell me about your alcohol consumption on a daily basis or on a weekly basis. What role does alcohol play in your life? So now all of a sudden we don't just have bits of information, we're beginning to learn from the other participant. We're learning from the patient. How do you believe that your alcohol consumption impacts your family? Now, all of a sudden, that is what framing from learning is. We're learning from our patients. We're learning from the team. How does this work? How does this impact you? Next slide, please. So not only do we have things like, framing, but if we think about promotion versus prevention framing, these are the types of frames. So if we think about promotion framing establishes the ideals, the goals, the sense of eagerness to attain them, and that new situations are framed as what gains can be achieved. In other words, if we look at this and we think about this in terms of like developing a new line of business, promotion is promoting what it is that this process is going to have. We're establishing a new set of ideals, a new set of goals, a new sense of eagerness to obtain this project. Everything is very forward thinking, as opposed to, well, are we doing this to prevent something? We have it as, well, we have to save money, or we have to improve this process-based thing in prevention. I think about these two things in terms of offense and defense. When you are on an offensive, whether you're talking about sports, probably the most easy thing to conceptualize this with, if you're on offense, you have some very long-range goals in mind. You want to put the goal, put the soccer ball into the goal. We want to do this. As opposed to when you're on defense, you're just trying to work one step at a time at preventing the other team from putting that soccer ball into the goal. So promotion is very much a forward thinking, a chess game to put the right pieces together in the right parts, as opposed to strictly just playing defense. Next slide, please. So as we think about execution, Pat talked a little bit about this versus a learning framework. And this is a very good table to think about this in terms of leadership's role, the leader's view of an execution versus a learning framework. So if the leader's view of themselves is that and I think this is something Nadia touched on. If the view of the leader themselves, I know what needs to be fixed. I know the problems as a leader. I know how we're going to carry out this project. From an execution standpoint, that leader knows what it is that we need to do and in what position they're in a position to tell others what to do. As opposed to in a learning situation, that leader finds out that that he or she is actually important and interdependent upon the other people's view of what that project really is. And they know and begin to he or she as a leader begins to see what it is to overcome, or what challenges there are to overcome. So if that leader then takes on the leader's view of others is, you're just carrying out this work. The first one is, I know the problems. Here's what the problems are. Here's what you need to fix. The next one is, the leader's view of others are there just to carry out the project. Well, in an execution framework, well, that's really easy. We'll just bring in people from outside, or we'll have subordinates actually make these changes, because we know what it is. Somebody that's completely unfamiliar with the organization can come in and just build this as needed. But in a learning framework, they value those partners and their essential inputs, and in overcoming those challenges. Okay, again, looking at this from an execution standpoint to a learning framework. The overall view of the situation is created by the project. So now we've taken this really out of the leader's framework and put it into the view of the project. And so if the overall view of the situation is created by the project in an execution framework, it's okay, well, this is the same. We're creating something, we're molding something, and it might be the same or not really different from the changes that are being made, because we're just taking this on piece by piece. In a learning framework, it can be challenging. It's full of unknowns. And even though it can be challenging, the opportunities are there to really try a lot of new concepts and new techniques and do a lot of experimenting. When the tacit goal, the thing that everybody wants to accomplish in an execution framework, is we just want to get the job done. We just want to make the changes. We want to implement them maybe quickly and very sterile, as opposed to a learning situation, whereas everybody's really trying, you're creating an environment where learning as much as possible to figure out, what are we going to do next? Or what about this project that nobody's even thought about until we came together collectively? So, the next slide, please. As we think about what we've done with Kansas to Kenya over time, or what I've learned, these are more my own personal reflections. I've been with Kansas to Kenya for, this would have been my 3rd year. And what I've learned in terms of what is framing is that we really do minimize. When we come into Kenya, and specifically when I came in for the first time, I realized that we had to minimize that top-down leadership role of somebody standing there and kind of directing and dictating what needs to be done. We really had to have both Kenyans and Americans working together, because there were so many things that obviously the Kenyans knew. They know the cultures, they know the community. And so it very much aligns very closely with kind of framing what it is that the Americans do when they come there, and what is it that we rely upon the Kenyans. We just can't transplant a bunch of Americans in a very sterile environment and expect them to be as functional as they possibly can without the assistance of our partners in Kenya in looking at what it is they know that we don't know. I think one of the most important things that I learned last year, and this was what I was so excited about, is that a couple of years ago, we began to use pharmacy students from the University of Nairobi. And we have translators. We hire translators, but the difference that it made is when we put Kenyan pharmacy students in the triage area to interact with the patients as they came to the clinic with what it was that they were there for. What did they really need from us? And the difference was that those open-ended questions, and a translator, they might say, this person's here because of their back problems. But when you interject, let's say, a pharmacy student in that same situation, we really learned a lot more about that patient because these conversations went on, and the pharmacy students, the Kenyan pharmacy students, could interpret that and then communicate to the team what really is going on in this patient. So just like my father used to say, is that we should be listening more than when we talk. And so listening to the stories that these patients brought. Next slide, please. And I think the next good example of framing a project was, we've talked and we've mentioned several times about the work we've been doing over the last 10 years or so with teaching students and pharmacists about vaccinology. You know, the Kenyan experience in teaching students and pharmacists was really creating that learning environment. They came there with maybe their own preconceived problems and notions, but we began to bring them together in teaching them about the importance of vaccines, which they all probably knew, but put this in terms of where it was that where they worked. And most of these were community, but we had also a lot of pharmacists that worked in healthcare situations. And what we said, and what you see in this picture here, are a lot of participants working with each other. And you can see they're drawing them up. And not only are they receiving a sterile saline injection in this case, but they're also watching, and they're also working, and they're also seeing the experience of this from each other. And so that concludes my part here. How long did I get here? Oh, we're in good shape. And so in framing that project, and framing a project and bringing these participants together and trying to create this learning environment. So if you'll pull up my one on failure. And again, this works very nicely with Nadia's presentation on psychological safety.
And for this second session, we'll request you try and do it within 10 minutes, if possible.
Okay, we'll move right through this.
Thank you.
Okay, learning from failures. Let's just give a definition to what we perceive failure really is. It is a deviation from a desired outcome. This includes both avoidable mishaps and unavoidable outcomes. Outcomes from experiments where we're looking for failure, as opposed to other risky behaviors that might be accounted for in failures. So next slide, please. So you all have access to my slides, and you can see here, there are a lot of people that indicate that the real mistakes are just opportunities to learn. And each one of these, a couple from an American inventor, Thomas Edison, that failure is a success in progress. A couple that I really liked was John Wooden is a coach at a university level. Failure is not fatal, but failure to change might be. So you can kind of read all these. They're all very positive about what people have learned from failure. That if we don't fail, we're not moving forward. Next slide, please. So dealing with failures, and you got to think about this in terms of what Nadia brought to us about psychological failures. Obviously, there are huge failures, and I list a number of them. The space for Americans, the space shuttle Challenger that exploded, a rocket that as it was taking off, bridge collapses, things that show up on the front page of the newspapers or on the internet. Obviously, governments have failures. Corporations make mistakes and have failures. But if we think about things in terms of those small failures that are not catastrophic but create an opportunity to learn. Next slide, please. So one of the things that Amy Edmondson alludes to in one of the chapters of her book, and I'm going to give it a little bit different term, is this normalization of deviance. And what do we mean by this? So the American sociologist Diane Vaughan defines normalization of deviance as it's the process in which deviance or deviation from a correct or proper behavior or rule becomes culturally normalized. In practice, what this means is, a process where clearly unsafe or incorrect practices become considered normal because it doesn't immediately cause a catastrophe. So this is the erosion of failure over time. Whereas all of a sudden, you do things an incorrect way for so long that all of a sudden it becomes the normal until we have a catastrophic event. Next slide, please. If anybody's ever talked about quality improvement or things, it is the Swiss cheese model. This is one that's thrown around in the United States quite a bit. So if you line up pieces of Swiss cheese that have holes in it, oftentimes as we progress through this, you can see at some point you're going to hit the next piece of cheese. And so that really becomes this normalization of deviance, is that we didn't do something correct, but yet nothing bad happened until that top arrow, all of a sudden the holes of Swiss cheese align and all of a sudden you have a catastrophic failure. So it is, how do we remove the things from failure, but yet still begin to learn from those deviations? Next slide, please. Why is it so long? The fact that we have so many, I gave so many quotes from reputable people and famous people who say failure is a good thing. If we don't fail, we don't move forward. Why is it so difficult to learn from failures? Well, obviously, there's all kinds of things. We put self-esteem, that people intellectually appreciate learning from failure, but in fact, they have a natural aversion. I don't want to be the one that fails. Failure is tough to talk about. Obviously, it's great to stand up and cheer about how we've been successful, but when we begin to talk about our failures, people begin to recoil, and they don't want to be the one that's the focus of attention when we talk about things that fail. And with psychological, safety, we need to develop an environment that says we learn as much. It's not bad to fail. In fact, failure over and over obviously is going to help us improve when we talk about it. Organizations often punish for failure. In the United States, a number of years ago, there was a real attitude towards creating a just culture. And a just culture was trying to help and trying to help people to begin to say, when you make a mistake, we're not going to punish you for this. We actually encourage you to talk about this, because what we learned from your mistakes and your failures are going to help us improve it for your colleagues from what we learn. And so despite the fact that we still have what we call a just culture, that we're not going to penalize or punish people, that is in fact a very difficult thing to do, because we try to create this blame game, as we have to begin to start pointing towards the person Who's responsible for this? We need to identify that person when something goes wrong. And in most cultures, it's failure and fault. Not only did something bad happen, but we need to point to somebody that says it's your fault that this failure happened. And so again, despite the fact that we need to learn in a learning environment from our failures, are we creating an environment with the kind of psychological safety that's required to really learn from that? Next slide, please. In the interest of time, you have access to these slides, but here is a number of reasons for failure and what they actually define. From deviance, in other words, an individual is choosing to violate a prescribed process, versus number 9, where exploratory testing and hypothesis testing, where we're going in and actually looking and trying to make the system fail. So if we look at this list of reasons for failure, where is it that we can really apply blame versus, where it becomes blameless? It's not an individual person. So because we can't talk about this and can't have a show of hands, I'll just tell you that we draw the line of deviance or blame, being able to blame it, really here at number 1 or number 2, deviance and inattention. So the line can go either here or here, where you can actually say, it's really your fault. You chose to violate prescribed processes. As opposed to every other one of these, the individual doesn't have the skills. We've put people in a position to fail because they haven't been trained, they don't have the skills, or a task challenge. An individual is faced with a task that's just too difficult. We've created an environment where that person is likely to fail. And so if we look at this, if in studies, it's less than 2% of the errors that are occurred and the failures that occurred that actually can be what they called blameworthy. We can point to a person and say, this is really your fault. So that means 98% of all the errors of all the failures are really due to processes and failure to have good things in, or good safe practices in place to create an environment where people will succeed. Next slide. Okay. So teams fail for 2 basic reasons: technical challenges, equipment, technology, things that you can put your hands on. But there are also interpersonal challenges that are less obvious. How do people work together? And I think this really rolls into the best example of this is when you create a team, it's not really the technical challenges that are difficult. It's those interpersonal relationships. It is getting a bunch of IT people together and them looking at a problem and having an IT person solve a problem, an information technology person, when they don't have access to the clinical folks that can help describe this. These are the differences between type A personalities and type B personalities, is that you need that balance within a team so that there is not the loudest voice that is going to get all the attention. And so it is obviously that interpersonal challenges are really probably the dominant reason teams fail. Next slide, please. So other types of failure. There are preventable failures. Those are the ones that are inherent to the system. They're the ones that really we can say are considered bad, because if they're preventable and maybe they occur so infrequently we haven't identified them as a real problem, those are the things that lend themselves to being discussed as part of a team. There are complex failures. In other words, we work in a complex environment. healthcare is a complex environment, and we never know from day to day what processes might break down that are really arising from things that we've never experienced before. They are the one-off problems. And then intellectual failures. And these are the things, the failures that are really good. These are the experiments or the trials that we do to try to say, you know, what can we learn from what worked, what didn't work, what worked for you, what didn't work for me. Next slide, please. And then the last slide here is really thinking about errors in terms of, we talked about what's blameworthy, but if we think about attribution error, the tendency to ascribe personal rather than situational explanation for others' shortcomings. It makes us less aware of our own contribution. So if I'm pointing my finger at Pat saying, you're the problem this failed, it's not looking at what did I contribute to why this team didn't reach its full capabilities. And so we really have to think about failure in a positive sense as to what we didn't do collectively as opposed to what we didn't do individually. Thank you.
Thank you, Ken. I know we rushed a little bit, but we just working in the interest of time.
Yeah.
Appreciate the presentation you've done. So we still have one more session, or rather two more, which we'll try and do within the next 15 minutes maximum. And the next presentation is by Peter Karimi, which is Spanning Occupations and Cultures. And this will be presented by Pat Parker. I think Peter is not here with us. So Pat, we will request that you take us through the Spanning Occupations and Cultures. If you can squeeze it to around 10 minutes, that would be great. Do your best.
Patrick, do you have a slide deck for that section?
Let me just, you have it? We don't have it. Is it part of the PDF that you had sent earlier?
I gave him a set of slides as a starting point. So I assumed that he was going to write a set of slides in relation to that. But I'm happy to talk about that. I think that why don't you just give me about 5 minutes just to talk about that framework that's associated with cultural interplay.
That's perfect. Proceed.
I think the key to this little bit of information really needs to be thought of in a different way. I think that sometimes we recognize that you get on a team and you realize that there are a whole group, there's lots of different people engaged in this team. One of the questions you have to ask is, if you're building a team, what do you want to do? Who do you want to put on the team? What is it you want to have on your team? And a lot of times you'll look at it and say, well, I want people that I know, that I can trust, that I can work with. And what happens when you do that is that you lose the opportunity to get new thought and new thinking. And so you end up with kind of staid solutions. You end up with solutions that are not ideal. So one of the things that high-performing teams typically do is that they look at kind of two sorts of things. They look at, are the people that are on the team, do they have a varied approach and a varied knowledge base? Do they have a knowledge base that is functional for what we're working on, but perhaps outside of what we would normally think about? Because those folks may be the best contributors to the team. The other thing that's fun about this is, from a cultural standpoint, you see people that react in a certain way. And it's based on their personality types. Do you want the personality type that is one personality type on your team. And let me give you a couple of examples of who that might be. The type A type personality that's a go-getter, they'll get things done. You want those people on your team, don't you? But there is a problem with that. Those folks look at things differently. Their whole goal in life is to get things done and get on to the next idea. So if you ask them to complete a task, they'll complete the task, they'll get it done. But it may be a lick and a promise finish. It may not be the quality of the work that could be done if you've got people that are contributing in more depth and with more knowledge. Another example is if you put people on the team that are wholly interested in social activities, that, they want to make sure that everyone is valued. What you'll end up doing is spending your entire time talking about, has everyone contributed? And has everyone had a chance to think about it? Well, if that's all you're doing is talking about, has everyone had a chance to contribute, then you really, a lot of times, are not moving the team forward as quickly as you could. Likewise, you have people that are very data oriented. And without the data, they're not comfortable. Those folks, they may be the very best people to help you provide data, get data that supports what you're trying to do, but it may never be enough to move things forward. Well, we have to have more data or we can't move forward. Sometimes with teams, you have to move things forward without knowing what the final result's going to be. And in fact, if you're inherently looking at things that have not been done before, that's the reality that you're going to be dealing with. And so you want to have people on your team with all of those personality types. You want to have people on the team thinking about where you go next with that. Some real good examples of that, and we could talk about those peripherally sometime, or maybe in another program, but there's lots of opportunity for that. I think the other piece of this is, how do culturally people view one another? This is an important piece of information, and I think that that's key. When we go to Kenya, kids would come running up to us and say, "Hi, how are you? What's your name?" "I'm Paul." And they would stand and smile and they would talk to you. Culturally, that's acceptable in Kenya, and it's very much expected. In a visit to Japan, I've got a son that was teaching in Japan. The kids would come running up to him and they would literally put their hands in his pocket, because if he had been gone, they knew that culturally he was expected to bring them a small gift of some sort, and they knew that he had it in his pocket. Culturally acceptable. Would that be culturally acceptable in Kenya? For a child to come up and put their hand in your pocket expecting a gift? But in Japan, that was not only acceptable, but expected. So I think those kinds of things, those cultural expectations, are very important. It's interesting in Kenya that the reverence that you provide for older people, and as I've gotten older, I have very much appreciated that. By the way, people treat older folks very well in Kenya, and I've always been very impressed with that. And in the U.S., it's kind of, well, you're old, you're not, your opinion isn't valued so much, because you're old. But in Kenya, it's like, you have a knowledge base, you have life's experiences that you can bring to the table. That's an outstanding thing to provide. I hope that we're providing some of that. So those cultural exchanges are very good experiences for the U.S. and hopefully for the Kenyans that we deal with. And when you're putting together a team, understanding those cultural differences is very important. That's all I'm going to say about this. There was more to be said, but I'm going to, again, in the interest of time, I'll go ahead and move on. Patric, I know you have a section that is to me, is a very interesting section, because the ASHP talks a lot about leading yourself. And I look forward to hearing it. Patric, by the way, has gone through the ASHP's program, And as one of the folks with that designation as part of his work, and I've worked with him for a number of years, so it'll be fun to hear what, Patric, you have to say about that.
Thank you very much, Pat, for taking us through that session. We really appreciate you feeling quite well. And I'll move to the last session, which is basically about leading yourself. You realize before you lead others, you should be able to lead yourself. So the session, I think I'll use this. Yeah. So you can move to the first slide. So the first slide, I've deliberately put a photo with Robert David Anderson. Robert David Anderson is a pharmacist who was honored in the US with the Harvey Whitney Award in 1976. And he gave an address. His acceptance speech was actually entitled "Deprofessionalization," or the peril of deprofessionalization. And in that speech, he challenged pharmacists to demonstrate value to the system beyond the traditional dispensing. So I came across that article way back in 2004. At that time, I was working at the Mater Hospital, and I found it quite exciting, and I got in touch with him. And he became a longtime friend. And in 2011, he forwarded an email to me, which was basically introducing opportunities at the Pharmacy Leadership Academy for International Pharmacists. And that's how I ended up in the Pharmacy Leadership Academy. We lost him 2 years ago in 2023 at the age of 98. But then in 2015, he was able to facilitate my attendance at the ASHP celebration for the 50 years anniversary. So that's where we first met physically in 2015. Can proceed. So basically, what I want to emphasize is that the most important person you'll ever lead is actually yourself in any situation. And each of us, we are all unique and special, just the way our DNA. I mean, if we pick your DNA today, none of us will match each other. So we are all unique. And that's really the premise of what we do. And in that case, each of us has a potential that is untapped. We really need to tap into each other's potential. And for that to happen, we need to work with others. We need to be mentored by others. Personally, if I had probably not reached out to Robert Anderson, maybe I wouldn't have done the Pharmacy Leadership Academy program. And that came from an article that was published. And we got in touch, we published the article. So there are unique opportunities that come along our way. Just go to the next one. So the way I framed this presentation, we'll talk about maximizing on opportunities. Then we'll also talk about minimizing some of the unproductive aspects. And then lastly, we'll talk about a few tips to maximize our leadership potential. Just move on to the next. So those are the three things that we'll focus on. We'll look at maximizing opportunity, minimizing unproductive aspects, and then achieving potential. Just move on to the next. So to achieve our potential, there are three things we need to look out for. One is the mindset that we have. We need to have a can-do mindset, a mindset that we can actually do it. Because sometimes you're faced with challenges, and if you are not in the right mindset, you might actually find yourself stuck. So and this begins with our leadership vision. What's our vision? What do we envision to achieve? And you need to have dreams, passions, and a sense of purpose in whatever we do. And it really helps to begin with the end in mind, so that even as you progress within your career. You don't retire on the job. We've listened to various trailblazers right from Thursday, and you realize most people have been moving from one opportunity to the other simply because they did not land at an opportunity and stopped there. They continued moving on. Then the second thing is also to have courage. Leadership is about taking responsibility. Responsibility for inspiring others, responsibility for results. So that calls for making decisions. There are certain decisions that we need to make. And it's so important for us to be in charge, responsible, and also accountable. Accountable to our profession, and also accountable to the appointing authority. And in these leadership positions that we are in, right from when you graduate, you'll be responsible for a team. You'll be responsible for tasks that have been assigned to you. That is a leadership role. And it calls for us to even take risks. There are times when you need to take calculated risks. Things may not be very obvious. As you saw from Pat's presentation and what Ken presented to us, we are faced with uncertainties. In these uncertain moments, what do? You have to take risks because not everything is clear. Then the other key thing also is about leadership effectiveness. Here we're looking at how organized are we? How do we spend our time? We are all blessed with 24 hours in a day. Part of that, the wakeful hours, is probably around 16 hours. How do you spend that as a pharmacist? Yeah. Then the other resource that we're also looking at is how do you distribute your time? There's time that you can use, especially in this time and era where we have these gadgets. They can steal a lot of our time. And you may find you are switching from one space to the other. So really, that is the other key point. So I'll skip other slides. We'll not spend a lot of time. You can move to the next. Just go to the next one. Next. So I'll not spend time. We'll share this. Just go to the next one. Yeah, I think I've already talked about this, but maybe what I want to emphasize there is don't play the victim or blame game. Be accountable and accept situations and look out for the way out of a situation. Go to the next one. Yeah, so the other point is perseverance. You've all heard from our seniors about the challenges that we face. And what I can say is be like a river. A river will encounter obstacles along the way. When you encounter these obstacles, you need to find the way out. And the way out could be by coming up with innovative practices. We move away from the traditional practices, and that will help us to create many opportunities. And never ever give up, because there'll always be a way out. Can move to the next one. So then just go on. Yeah, just move on. I think I've already touched on this. Yeah, for use of your time, we talked about priorities. I'll not just move on to the next. Yes, this is about how you spend your time. And there's a time for everything. There's a quadrant that is usually used to help to bring out what is important, what is urgent. So you have that opportunity. You can actually spend time solving crises, and that comes at the expense of strategic things, because the crisis of today can actually steal your time to strategize for the future. Just move on. Just move on. So just move on to the next one. So this is the second component, and that is achieving your leadership potential. And here I've put a few points. One is take time to invest in yourself. And I really want to appreciate those of us who've spent the last 3 days in this symposium. Apart from celebrating the 50 years, I'm sure you've gotten something that will sharpen you, that will help you to be better. So invest in yourself, learn and grow. Growth it actually doesn't stop. Just like the plants, they keep growing and growing. So let's embrace that learning culture. And then you also need to engage mentors, people who will guide you on where to go, because at an early stage career, you can benefit from their mistakes. They can guide you. So look out for mentors who can help you, who can guide you, who can help you to see things differently, and then you learn from them. Then the other key point about achieving leadership potential is it helps you also mentors can help you to link with opportunities. I've given you the example of how I ended up in the Pharmacy Leadership Academy. It was an email from a senior pharmacist. He was already a retired pharmacist. At that time, I believe he was over 80 years old. But he saw this opportunity and he thought about me. And I also saw the opportunity and took advantage of it. I'm sure if I ask my colleagues here, people like Ryungu, Grace, those of us who are in this generation, they'll tell you that some of the opportunities that have come along our way have actually come through our mentors. Then the other one also is the mentors will help you to sort of be able to identify opportunities that you may not ordinarily find. And then the other one is take time to read widely beyond the pharmacy profession. That is where you will learn something that you can actually be able to apply. Can move to the next. Let's go to the next one. Yes, so here I was just emphasizing, I think I've already emphasized the key things, but then something that I want to add on there is the importance of being in our professional associations. It is where you get to network with each other. It is where also you get space to contribute to the profession. So really, that is something we cannot underestimate. Can move on? Then in terms of direction, yes, the horizon may not be very clear, but then at any given time, be clear on the goals that you are chasing. What goals are you pursuing? Because that will give you the sense of purpose, it will give you a sense of direction, and when opportunities come, they find you ready to embrace them. So periodically, try and see where are you in terms of career progress. It could mean taking an online course. It could mean taking a fellowship somewhere. Those are opportunities that are available, and depending on your goals, they can actually take you to the next level. Then the other key thing also is, as pharmacists, I think we are used to doing very well. You're used to scoring very good grades. And when you get out there, you can also be very hard on yourself. So don't be so hard on yourself. Sometimes you need also to be flexible. Remember from Pat's presentation, you are type A personality, you may want results all the time. But then at what expense? You need to ensure that you are able to move along with others. Next. So we will move to the third component. Remember, the first component was about your leadership potential. The second component was about realizing your potential, yeah? And this third component is about minimizing some of the unproductive aspects, because everything is not smooth. So I'll just touch on this. There are things that are inevitable in our work. One of them is conflict. So we need to be able to manage conflict. And conflicts are important. They can actually take you to the next level. But then it's important to seek first to understand, then to be understood. I think if you've read the 7 habits of highly effective people, that is one of them. And it really helps because you will be able to de-escalate conflicts and ensure that they are productive. Then the other thing is mistakes happen. And I'm glad this has just come from the session that Ken has taken us through. I don't need to overemphasize that. Let us learn from them. Then the third one is about politics. I've worked in the NGO world, I worked in the hospital, and now I work in the county government. In all those spheres, politics are there because there's the formal structure and there's the informal structure. And somebody said that if you don't do the politics will do you in. So you really have to understand your environment very well. You should be able to see how best to harness what is there without being destructive. So the other thing is just having a plan B, because sometimes things don't go the way you want. In the county, I serve as a technical advisor. So there are times you give technical advice. Sometimes it will be taken. Sometimes it can be rejected. Sometimes it can actually be modified. So initially it was very difficult because you would look at things and you would think these are very obvious things that you expect them to go in a certain direction. But it's good to be open and realize that there are many ways of achieving things, and knowing the terrains is one of them. Then the other one is about setting your own goals. I had a boss one time. He was a pharmacist. I'm sure most of you know him, Dr. Michael Thuo. And one of the things that he used to tell us at the Management Sciences for Health is, if this is the goal that the donor or the funders have set for you, then for us as an organization, we set a higher goal. And that's how you are able to ensure that you're ahead of the game at all times. So that's something I would really want to reemphasize. Next. Then the other issue is the nature of our work. It's high pressure environment. For those of us who work in the counties, there are times you get calls that expect solutions, and it's not easy. So it's good to be able to work under this pressure, but then beware that you can also get burnout. So you need to balance out on that aspect. And then the other thing that I found very useful is developing a passion outside work. You know, sometimes work can be very tough. And when it's tough at work, if like Reverend Moses, you have a sermon to give on a Sunday, that will energize you. For me, I do work in the community. On 19th July, we'll be having a marathon in Elda Marawin constituency. And I would probably invite pharmacy team, pharmacy alumni, to come and join us in that marathon. It's a marathon to raise funds for a school that we have set up, a school that is sponsoring children. So those are things that give you outlets that can re-energize you, and also find roles within the profession. Then the other key aspect is the self-talk. the conversation we have in our minds. I'm sure when you came for this conference, you had expectations. Even as it unfolded, you were seeing expectations met, some were not being met. So as an individual, beware of this self-talk. Ensure that it is positive. Watch out for the negative self-talk that can make it difficult for us. Live in the present and work on creating the future that we desire. And also, there's something called complaining. Say you avoid it, but then you need to have an outlet to complain. Have a way of venting that complaint that you have. And the other last thing is being resilient. It's not easy surmounting some of the challenges that we face. But then we need to be resilient. We need to be able to bounce back when we are faced with challenges. Remember, this journey is not a sprint. So it's a long journey. We've heard from other speakers before us how their journeys have been. So you can move to the last. I think that should be the last. So I want to conclude by saying that leading yourself is a lifelong journey. It's not a destination. And like that road, Professor Kigen has traversed that road from Kabarnet going to Iten. You can see how winding it is. When the leaders were reminiscing about their milestones, I'm sure if you were to do the river of life or the road of life, it would be something like that. Yeah. When Professor Ogaja was in NQCL, then she went to the university, she went to Kisumu County, and she's still thriving, isn't it? Yeah, so each of us, our journey is something close to that. It will always be winding. There'll be obstacles, there'll be challenges, but it's up to us to really utilize some of the tips that we've shared and many other speakers have shared so that we can traverse this journey and be able to celebrate milestones within our careers. Thank you, and thank you very much for your attention. I don't know how much time I took. I was supposed to be moderating myself. So, but this has been the session on leadership, and we've heard from Pat Parker, who's talked to us about organizing to learn, and we've appreciated that pharmacy is a complex adaptive system that is not linear. So we need to really learn from it. Ken has through framing to learn, and Nadia ably took us through psychological safety, and we've appreciated quite a lot. And again, Ken took us through the session where we were able to learn from failure. So we now know that when things don't go right, we can pick lessons from that. And you heard from Pat Parker on spanning occupation cultures and leading yourself. So leadership is a component that I would say is not usually covered so much in our curricula, but I must say that through this collaboration with the University of Kansas and the University of Nairobi team, we've been able to mount these programs on a regular basis, and I believe they've been useful. So there's a lot for us to learn, and let us learn continuously. So as I conclude, I want to invite Professor Gwantai just to say something, and then we move to the next session, which is basically the closing and keynote address. So I believe from these many sessions, Prof, you may have distilled some nuggets of wisdom that you can share with this team as a parting shot, and then Pat Parker and your team, we want to appreciate your input. Over to you, Prof.
Okay, I think you have seen me coming in and out, and not even able to concentrate on each and every presentation that has taken place. I think that is part of leadership and management. Because when you have an activity like what we have had for the last 3 days, a lot of coordination is required. Otherwise, things might not flow as expected. So that's why you have seen me moving in and out to make sure that all the activities are coordinated for effective delivery of a successful symposium. I think we shall have closing remarks, but from the afternoon session that we have had, the most important take-home message to me is that as pharmacists, when you are trained, realize that you are leaders. Right from the beginning, you are leaders, okay? And a leader or a manager can choose either to be an occupier of an office, like Okwaro said, you can just go and sit and occupy an office and pretend you are a leader, or you can be a leader that identifies your goal, identifies the goals of the institution that you serve, the goals of your customers, and deliver on the same. So you can actually choose how to lead, okay? But first and foremost, remember you are a leader. The presentation that we have been given by our colleague, Patric Boruett, talks about starting by leading yourself, because without leading yourself, it will be very, very difficult for you to lead others. If you are a disorganized person and you are made a leader, you end up disorganizing everyone else that is within your circle, okay? So start by leading yourself and ensure that whatever you do is actually properly thought out, planned, before you even execute. Because without proper planning, you cannot actually be able to execute. So start by learning how to lead yourself. What are the components that you require to make sure that within you, you actually feel you are a leader, and whether you are being observed or not, you're able to deliver what you have planned to deliver. The other take-home message is that failure in life is sort of mandatory. It's a mandatory outcome, okay? You'll have to encounter failure at any one point in your life, at one point in your life. Some of us go through a lot of failure. Others probably they are lucky, and the kind of failure that they encounter might be, the incidences might be very few, or probably the failure is not very big, so it doesn't have a larger or a major impact. But it's very difficult for you to be able to foresee the future in terms of what kind of failure are you likely to go through, because life is dynamic, life is complex. You cannot be able to control the future. So please learn to manage failures, okay? Learn to manage failure. We have been told that failure in itself, you can actually learn from it and you get a positive outcome. Instead of mourning about it and get depressed, okay, in which case you'll get a negative outcome. So every failure that you go through, always identify what lessons you have learned. So again, to me, that is a take-home message, okay? You fail in your exams, like students, you start screaming, okay? You'll be told, not only have you failed to have a supplementary, you might even feel so badly, you have to repeat, okay? Oh yeah. You might even feel so badly that you are discontinued from the program. So as students, if you don't manage that level of failure, you end up being in Madare Hospital, okay? And one of the things that I used to encourage the students when I was dean is that whatever you go through, either social or academic, during your training program, if it negatively impacts on your progress, come to me, so that we have a one-on-one discussion and see how I can contribute to helping you manage whatever is negatively affecting you. And I think it used to work quite well, okay? Although, of course, I ended up being stressed myself. It's like transferring the problem from the students to me. But I felt probably by my age and my long experience, I had a greater capacity to absorb, much more than they had. And mine was more than just a teacher, but to mentor them, not only on academic issues, but also on how to manage psychological issues. So for my practitioners, you are not students, but all the same, you are going through life at different stages of your growth, either academically, professionally, or whatever, okay? And again, as we have mentioned, you definitely have to go through some kind of failing, okay? Closing your business, having some probably health issues, like, when you are above 60, 70 there, like ourselves, you end up with bone aching there, knee aching there, and back aching there. And therefore, all these issues are part and parcel of your life, okay? And you can only succeed if you know how to identify what you are going through, how it is affecting you at a personal level, how it is affecting the people that are around you. Because if you complain too much, and probably you are even a family person like we are, you end up affecting the other people around you. So make sure that you identify the level of the failure that you are going through, the negative impact that you are going through, and how it is affecting the other people, and see whether you need to bring even other people on board to help you address that issue that is affecting you, okay? Do not be too introspective, okay? There are times when it helps, but there are other times when you have to speak out, So learn to know when you need to speak out and look for support. That is all part of leadership. You remember learning to lead yourself, okay? And you can only learn to lead yourself by identifying what issues you have before you go to the other people.